Welcome to the Wednesday morning's Science Circle presentation. I'm Bob Spiritus. I coordinate this. Bob Hopper, our president, is in the back greeting people. We're happy to have you here either in person or zooming in for this presentation this morning by Dr. Susan Woods. She's a board-certified dermatologist with 25 years of experience. And she did her undergraduate work at UC Berkeley, Tufts, then went to Tufts University Medical School, and did her internal medicine internship at Harbor UCLA and dermatology residence at Case Western. She did bench research as well as an externship in wound healing at the University of Pittsburgh, where she was introduced to platelet-derived growth factors, and that's what she'll be talking louder and closer to the mic. Yeah, I keep thinking I have a loud voice, but people keep telling me it's not true. So after she did her dermatology residency, she was recruited by Northside Medical Center in Youngstown, Ohio, to start the first multidisciplinary wound care center in Northeast Ohio. And she's one of the first pioneers to formulate platelet-derived growth factors using hospital lab and began phase 1 IRB approved trial for use in patients. It says trail here. I assume you meant trial. And Dr. Woods opened her own private practice in Austintown, Ohio, and it's expanded to deliver medical, cosmetic, and surgical dermatologic care in the area. She's married to Dr. Larry Schmetterer, who spoke here last year, who's a surgeon, and their home is on the grounds at Chautauqua. They have a home here on the grounds and have many memories here with their 2 sons and their dog Waffles. Please give a warm Chautauqua welcome to Dr. Susan Woods.
Thank you, Bob, and thank you for coming this morning after all the 4th of July celebrations late last night. It's wonderful to see a crowd and have you learn more about platelet-rich plasma. And platelet-rich plasma, to my surprise, I started my career in medicine with it, investigating its uses in wound healing with diabetic ulcers in a wound clinic. And to my surprise, I am still using it now, but for cosmetic uses for patients who want to have a vampire facelift, which is a non-surgical facelift, and I'll speak about that with PRP, as well as hair restoration. So this therapy has stayed with me through my career, and I have a great passion for it, but I'd also like to share the puzzles with it. We do not have it all figured out, and that's 25 years later. And so first of all, what is platelet-rich plasma? And it's a popular approach for regenerative medicine. And what that means is it helps heal. It's a healing therapy. And patients like this because it's natural. It comes from your own body. They love it that it's not going to be a pill that I prescribe. So it's coming from your natural body, and it has many healing properties. But platelet-rich plasma is only FDA approved for bone graft treatments in orthopedics and the dental field. So that's really the only FDA approval that we have gotten despite its widespread use. It's used in diabetic foot ulcers, in wound clinics, as I spoke about, and also in dermatology and plastic surgery. Platelet-rich plasma, or PRP, has just exploded with aesthetics. And so we refer to platelet-rich plasma as liquid gold, and the patients know it by this name. And today, as scientists, we will explore whether or not this is fool's gold or 24-karat gold. And the first step in making platelet-rich plasma is the patient comes in and we draw your blood. So as you can see here, my nurse is drawing blood into a blood collection tube. And this is the first step, which is exciting because you're using your own body. You're using the healing properties in your own blood for these therapies. And the next step in making platelet-rich plasma, after we've drawn a tube of blood, we put it in a centrifuge. If you remember back to high school or college biology class, this will spin the blood around. And as you could see in the test tube there, the liquid gold is at the top, which is the yellow substance. And that is what we're looking for, the platelet-rich plasma. That is the liquid gold. So in preparing this platelet-rich plasma, what is interesting is last year, the Academy of Dermatology put out a publication, which was a review of 40 articles in the dermatology literature making PRP. And they pointed out that there was 40 different ways of making this. Then what varies is the speed of the centrifuge, so how fast you spin the centrifuge, and the time of the centrifuge. And there are studies that say you should do the spin twice at a certain speed, you should do it once. And they warned us that we don't have the recipe perfected yet. And so that is a problem right off. But what is known is for those chemists, we put calcium chloride in the blood draw tube. And calcium chloride, from the very beginnings, I knew this in the 1990s when we made this substance in the wound clinic. If you put calcium chloride in the test tube and draw blood in there, calcium chloride will cause the platelets to lyse and open up. And when I was doing the phase 1 trial in the hospital, it was the lab technicians that told us that. So we were trying to make this substance. We went to the lab technicians and they told us, oh, you could use the test tube with calcium chloride in it, and this is going to open up the platelets and you're going to get the growth factors. So, so we have known that for a long time, but the spinning in the centrifuge, that still has questions. So we're able to open up the platelets, but we're not sure how long to spin this.
Do you have the Zoom? Do you need the link?
No, I'll continue those things.
And so here we are with the liquid
Oh, you
gold,
don't need to. I
the
sent you the
plasma
link.
at the
There's
top.
one-
And so what the therapy is the platelets are
What's it
in the
for
liquid
PRP,
gold or the
right?
plasma and the growth factors.
Yeah.
Like,
So we have drawn your blood, and now the platelets have opened up, and at the top would be the growth factors and your platelets. The red blood cells are going to be at the bottom of the tube, and we do not use that part for the treatment. We just use the top part. And so the liquid gold, again, what it is platelets and growth factors. And in the beginning, in the 1990s, we thought that it was platelet-derived growth factor. We thought that there was only one growth factor in the platelet. And this was because there was research being done in Sweden in the 1970s with platelet-derived growth factor, that one growth factor. And since then, we know that the platelet holds many growth factors, not just platelet-derived growth factor, but many platelets. But I want to step back first and talk about the platelet. So platelets are part of your blood, and it allows the body to clot. Most people know that. The clotting factor, if you injure yourself, the platelets come to the injury and they clot off the injury. and then they release growth factors that help your injury heal. And platelets are very important for that reason, the healing cascade. And the platelets with their clotting factor, sometimes if you have heart disease or if you're prone to strokes, you take medicines to block the platelets from clotting, such as aspirin. So aspirin will block the platelets clotting factors. And most people know about platelets because of that. They take aspirin to prevent the platelets from clotting. It helps your heart, you're told. But I think it's interesting, inside the platelet are these interesting growth factors. So they're just not clotting your blood, but they have contain healing factors in the platelets. So here's a resting platelet. You could see a very smooth, and then the activated platelet on the right would be, if you're injured again, that would be a stimuli for the platelet to activate and open up, and all the growth factors come out to where you are injured. And here is what is released from an activated platelet. And these are the functions that the growth factors are involved in. Angiogenesis, that is the growth of new blood vessels. The fibroblasts make collagen, and the growth factors activate the fibroblasts in the skin to make collagen. They're involved in inflammation, the growth factors, and also making your extracellular matrix, which is basically collagen underneath the skin, underneath your epidermis. And dermatologists, as I'll speak about in an upcoming slide, we are very interested in the fibroblasts, and that's where the aesthetic world is focusing with the growth factors in the platelets, because we know the growth factors stimulate the fibroblasts to make collagen. And collagen is youth. Collagen makes our skin stronger, takes away wrinkles, and that makes the platelet growth factors magical. So first of all, let's start with the growth factors in the platelets and healing the skin. And this is the early work that was done. It was with healing wounds with platelet growth factor. And so we knew the clotting cascade and the healing with trauma, that we knew that the growth factors in the platelets are very important for that. So why can't we just put it on patients who are having trouble healing wounds? And we know that that cascade involves making new blood vessels grow into an area of injury. The growth factors are going to activate fibroblasts to lay down collagen and recruit immune cells. And so this seemed like the magic bullet, the answer for patients who can't heal a wound, is you could just put this growth factor on the wound and that would speed up healing. And so once again, there's just not platelet-derived growth factor in the platelet, but there is the other growth factors, which we have learned are very important. The last one, the fibroblast growth factor, that is the one that the plastic surgeons and the dermatologists are very interested in, because that is the one that is going to make us look younger. So let's dive into the platelet-derived growth factor. That's the first one in the platelet that we knew about. And platelet-derived growth factor also will enhance collagen synthesis. This causes the proliferation of bone cells. And I was speaking to a gentleman before this lecture about this. He said that his orthopedic surgeon had recommended PRP to be used in his knee. And this is why, because the growth factor can proliferate bone cells, new bone cells, and the orthopedics are using it in joints. And the platelet-derived growth factor also is going to cause fibroblasts to move into the area and proliferate and activate macrophages. And macrophages are the immune cell that are in your skin that keep bacteria away and help in healing as well. So platelet-derived growth factor, in the 1970s, a team of researchers in Sweden discovered this. They did most of the work in the 1970s. They, at that point, we thought the only growth factor in a platelet was platelet-derived growth factor from their work. In the wound clinics, we were focusing just on that growth factor. But since then, we know there's other growth factors in the platelet. And so the wound healing, the scientific pathway that I've shown is very good for doing research in wound clinics using platelet-derived growth factor. And that is what we did in the 90s. Here are some studies with diabetic ulcers using the platelet-derived growth factor. And you could see with these studies, there's a little better healing using the platelet-derived growth factor, and it's a little faster. So the first study, we have 100 patients, and they were randomized to the platelet-derived growth factor or placebo, and you could see the 56% of patients healed with the platelet-derived growth factor versus 33% with the placebo, and the time to heal was faster, 56 days versus 43, but it's not terrific. So it's a little better. And study after study showed that, and in the wound clinic that I worked, that was true. You could use this platelet-derived growth factor on the wounds and was a little faster with healing, a little better, but not completely the answer. And the reasons for that is in the lab, some therapies work better than in real life, in practice. And what happens with the diabetic ulcers are some diabetics have very good controlled sugars, normal hemoglobin A1Cs, they're taking their medicine, they have good circulation, and these patients do heal better if you put platelet-derived growth factor on their wound. But how about the diabetics who don't have well-controlled sugar? They may have arterial insufficiency or blockages in their arteries to a limb, and so they're not getting oxygenated blood down to that limb. They may have venous problems and swelling. These therapies are difficult when you're using them as a clinician, because really need to use it on the best candidate possible. And so I think the studies aren't really fair because you don't, yes, these are all diabetic ulcers, but you don't know the conditions of the diabetic patient in the study. And I think medical research is lacking in that way because it's hard to control for all the variables. But from those studies, a pharmaceutical company did get FDA approval for Regranix, and this is platelet-derived growth factor to be used on diabetic ulcers. So you can get a prescription from this from your doctor, you put it in the refrigerator, it lasts a month or two, and it is platelet-derived growth factor. But let's move on to what dermatologists get really excited about, and that's collagen. And dermatologists like platelet-rich plasma because it enhances the fibroblasts to make collagen. And so this is good for anti-aging. And what is important, though, is that platelet-rich plasma activates the fibroblasts. So we have it in the test tube, but your fibroblasts are underneath your skin. So you have the epidermis, which is your top layers of skin, and you have the dermis, which is underneath. And how do we get this platelet-rich plasma under the skin? Because it's not going to help at all if we rub it on top of the skin. The fibroblasts that we want to activate to make collagen are not on the top of the skin, they're under the skin. So this has been a problem we faced for about 10 years. And finally, the dermatologists have figured out how we can fix that problem. But first I want to say, before I show you how we use this platelet-rich plasma in aesthetics, I want to say that there are no half-face studies. So we can't really say that this works for aesthetics and beauty until we have half-face studies where half the face is treated with the PRP and half the face is placebo. And we do not have any of those studies yet. So what I can only say today is what is the case studies in my own practice. And how we market the platelet-rich plasma for aesthetics is we market it as microneedling with PRP, and we call it the vampire facial. And you'll see why that is in the next slide. So how we've solved the problem of getting the platelet-rich plasma under the skin where the fibroblasts are is we first use a device called a microneedling device, which is a rotating device of acupuncture needles. And we first put numbing cream all over your face for a half hour, and we wipe it off. And then we use this skin pin, which is a microneedling device that rotates and puts channels down 2 millimeters into the skin, open channels into your dermis. And 2 millimeters under the skin is the secret depth at which your fibroblasts live in the dermis. They are 2 millimeters under the skin. So we use the microneedling device all over the face and have open channels 2 millimeters into your skin. And then we will put the PRP into those channels, and I'll show you how that's done. So here I am using the microneedling device. You could see that the skin becomes very red, hence the vampire facelift. And then the PRP I am rubbing into those channels. And we have found with the science, the microneedling device, the channels stay open for 24 hours and then they close. And the PRP is now under the skin. So this is a great advancement. And the PRP will cause the fibroblasts to activate and lie down more collagen and helps with wrinkles and aging. And it is a very popular procedure in my office. The patients, they do like it because it's using a therapy from your own body. It's very natural, and it does work. And lastly, in aesthetics, the PRP and hair restoration, this is a very popular procedure as well. But the science is very different than with the fibroblasts we're activating under the skin. However, the PRP with hair restoration is targeting the root of the hair follicle, which is under the skin. So think of a hair follicle, the anatomy of a hair follicle, as a tulip with a bulb. And the bulb is the root of the hair follicle, and the tulip is the hair follicle. So we want the PRP to stimulate these stem cells, which are at the root of the hair follicle. And so the PRP must be injected under the skin in order to find the stem cells that are at the root of the hair follicle. The hair is not living. The only living part of your hair is these little dividing stem cells, which are at the root. And so we are injecting the PRP near the roots of the hair follicle to try to stimulate those cells to divide. And in the test tube, you can get the mice hair stem cells. If you if you put PRP on mice hair follicle stem cells, they will divide. But in practice, it's not always so reliable again. And that's because the hair follicle goes through phases. It's almost like circadian rhythm phases. If you've heard of the growth of a hair follicle, anagen phase is the growing phase, catagen phase is the resting phase, and telogen phase is the falling out phase. And every single one of our hair follicles is going through that stage. And the growing phase can be from 3 months to 2 years. And all of our hairs go through this phase. So they are dividing, the stem cells are dividing at the root, but all of our hairs are in these kind of growth phases. So we don't really know when we're injecting the PRP if the hair follicles will all go into the growing phase, the anagen phase, or not, and will they stay in the growing phase? This is questions we have. But there are quite a few studies, and here's one study that I like that was done in 2015. The patients were given 3 treatments, which is standard for the hair growth. You get 3 treatments of PRP injected into your scalp 1 month apart. This is a half scalp study, which is nice. 23 patients where half the scalp is injected with PRP and half placebo, and the other half of the scalp is placebo, and they get 3 injections a month apart. And after the 3rd injection, the side that was treated with PRP has 45.9 hairs per square centimeter more in 20 patients. So 20 out of the 23 have more hair in the side injected with the PRP. This is very good. They also did a follow-up, which we like. They followed the patients for 2 years and only 4 relapsed in 12 months, which is excellent news. But I have to say this therapy, while promising, is not as good in my hands. And I do think that the hair follicle with its stages, the hair follicle has receptors for hormones, and the hormones oftentimes take over and put the hairs in the falling out phase. And so I think patients have to be on some other type of therapy to control the hormones and their effects on the hair to get this therapy to work. But it is promising, and I do think it's a good therapy because it's natural. And this ends my talk today. Thank you for coming out this morning to learn about platelet-rich plasma, and I would like to answer any questions that you may have.
Is this better? And so that we can record it. But oh yeah, and you can zoom in your question. Dr. Rizzolo is going to forward those questions. So if you're on Zoom, send something in. If you're here in person, come to the mic, please. Just a little bit. Okay.
This sounds brilliant. Is there any negative side effects? I mean, there wouldn't be an allergic reaction, but is there
No.
anything negative that goes on?
Nothing negative.
Nothing.
Yeah, that's what's nice about it. And you're using your own body to heal yourself, which is appealing to many patients. And it is affordable.
I'd like to go back to the beginning when you were doing wound healing. And when you were putting the platelet, the PRP on the wounds, were you using any semi-permeable membrane or anything over the wound after you put the PRP on?
Yes, we did. We used Adaptic, which is sort of like a non-stick bandage and gauze over it. And we had the patients come in weekly for the treatment for 3 months.
Did you consider using a semi-permeable membrane like Opsite, the
Yes.
others?
We were very limited with the wound, with what we had in the wound clinic because it was in the 1990s. Now they have many more options.
Well, the first study for the Opsite was done in the 70s by me.
Oh, how
Um,
wonderful.
I was only the resident involved, but I did all the legwork. And, we had patients with diabetic ulcers down to bone, down to tendon
Mhm.
that walked out with their legs, who were told they weren't going to have any option other than amputation. So it would be wonderful to go back and have this platelet
Yes,
plasma to use with the Opsite. that I
Yes.
used.
yes. It is one of the most gratifying experiences to heal those particular patients because the wounds are so serious and, and the stakes are high. If you don't get the wounds to heal, they are headed for amputations. And so it's very important work.
I have, I have white coat syndrome. And seriously, I faint when blood's drawn from me. And I find that doctors and lab technicians don't believe patients who say that and think it's all nonsense and in their head. But does this, like, if I needed this and I went in and you were drawing blood, how much do you need to draw? Can you draw it and cycle it and save it for 6 months or a year, or do I have to go in all the time?
That's an interesting question. The good news is one test tube will make about generally 7 to 8 1 cc syringes of PRP. So one test tube of blood does make quite a bit of PRP, but you really have to use it within 10 minutes or a half hour. Mhm. We draw like one test tube. Yes, just one test tube. Mhm.
The question was, how much do you draw? And the answer was, you draw one test tube. So I have a question from the chat and a question of my own. So does one make fewer platelets and growth factors as one ages? Is that why these replenishment treatments are needed?
It's a very good question. I don't believe that we make fewer platelets unless you have there are some conditions where patients have diseases where they have fewer platelets, but the aging process, when you do a blood draw, the normal range is the normal range for young patients and older patients. So we all have the same platelets, but and these platelets release the growth factors, but the target cells become less responsive as we age. So the fibroblasts of a young patient respond to the growth factors much better than an older patient. And that's why just in general, healing your grandchild who scrapes their knee on the plaza, it heals in 3-4 days. If we scrape our knee, it's 1 month. The fibroblasts very slow at laying down collagen.
Okay. I understand you've been using this on yourself and you're really 97 years old.
True.
So going to the hair loss issue, a treatment is finasteride, if I'm finasteride, but if I'm saying it right. And this is transient. It messes with testosterone metabolism, as I understand. And when you stop using it, you regress. So question one, is there benefit to using this in conjunction with the plasma technique? And my second question is, would a young person respond to the plasma treatment better than an older person, let's say? Or is it too late for me?
Well, it's never too late. But I do think once again, the target cells are more responsive in the young people, and treating young people who are just beginning with hair loss, you will have much more success with this therapy. But finasteride and a medication that will block the testosterone from landing in the receptors of the hair is very effective with the PRP, because the finasteride, doesn't give much new hair growth, that medication. It blocks the testosterone from landing in the hair receptors, but you don't get more hair. And so the PRP can give you new hair, and the finasteride can hold the growth that you got from the treatment. That's a very good question. More interesting is there's a product out, Nutrafol, which I didn't invent, but I wish I did. Nutrafol is FDA approved. It's herbal, and they have done research with hair loss, and they use herbs that block the testosterone effect on the hair follicle, herbs like saw palmetto and other ones, and that is very effective as well, and it's natural. And patients like to take the Nutrafol with the PRP because it's a more natural combination than the prescription Propecia, which could have more side effects.
Just because it's herbal and natural, so-called, doesn't mean it can't have side effects. So if it's blocking testosterone, is it really safer than finasteride?
That's a good question. Mostly the blocking of testosterone would be the action in the skin receptors and in the hair follicle receptors, but throughout the body, it could, saw palmetto is used for prostate disorders, and so it could have effects, yes.
Hi, thank you for an interesting talk. I have actually had PRP used. So I was going to ask about pain. I had it used for a high-grade hamstring tear. And unfortunately, now that leg is better than the other one. So the left one is stretchier, it's stronger, it's more resilient. And then now the other one that didn't get injured is just kind of like it was before. So the tighter one is now the looser one and the better one. So I don't know how to fix that to get the PRP on the other side. But I wouldn't go through the injury again for that. But it was incredibly painful. And they warned me, after we give you the injection of PRP, this will be incredibly painful because it's going to start the wound healing. And it was like I was back to day one of the injury.
Yeah, it is painful. The injections in the scalp is painful. The microneedling is not, because we can use a topical lidocaine cream. And so for the vampire facelift, it is not a painful procedure at all, interestingly. But the hair injections can be. Sometimes we put the numbing cream on the scalp to help with that, but it doesn't seem to help as much as we would like it to.
And can you use it for scar revision, for like post-surgical scar revision?
Yes.
Long time.
It does wonderful for acne scars as well. All scars, yes.
Thank you.
Going back to the finasteride and similar drugs, there's a big, long history with them because it's originally used for prostate cancer. And so there's a lot known about safety. When I think about herbal treatments, it's not so much the active agent that we're concerned about, but it's the, for lack of a better word, the junk that comes along with it, the
Mhm.
non-active things.
Mhm.
And might those have side effects? How long has that treatment been used, and what do we know about
The
side effects?
Propecia, you mean, or the PRP?
No, the herbal supplement.
Oh, the herbals. That has been out for 3 years. It did go through an FDA review. And interestingly, the FDA reviewed Nutrafol and said that it did get hair growth in 70% of patients, which is interesting, but you do have to choose your patients. So again, those studies are questionable. But what is interesting with Nutrafol is with the COVID pandemic, the dermatologists, including myself, saw many patients daily with their hair in telogen effluvium, which is the COVID virus seemed to interrupt the hair cycle from the anagen growing phase to the telogen phase with hair shedding. This was a huge problem. And many patients we treated with the Nutrafol, which is the herbal supplement, and some of them PRP to get their hair back in the growing phase. And it was very successful for those types of patients, but again, the studies are not as good as we would like them to be.
I found your talk raised some interesting quasi-ethical issues I'm curious about the medical profession extending FDA approval from one thing and then applying it to others.
Mhm.
And is there some process for approval or non-approval, or are we just in a free market, do what you want? The reporting in the media on scientific health, especially in the health field, is often appalling.
Mhm.
And the whole question of what's natural and how practitioners and Madison Avenue talk about the natural is, I sort of believe if it's here on the earth, it's natural. But if natural only means that it's somehow coming out of my body for use on me, I think we need to define these terms better. So that's a lot. Say whatever you want.
I think those are very good points. And I think that just because this therapy is coming from your body doesn't mean it's going to heal everything. It does just have FDA approval for the orthopedic bone grafts and the dental. So everything, all the other uses are off label. I think you have to have a really good relationship with your clinician, because not every patient coming through the door is going to respond to this, and you'll have a very unhappy practice if you use this therapy on every patient. You have to be very selective. And I think I saw that with the platelet growth factor in the wound clinic, that we really were just using it on the diabetic patients because the literature was the strongest there. But certainly, I think that we need to be supporting more research in the universities with these therapies, and the research coming out of just case reports coming out of clinicians' offices is really not the same as university-run studies, which we really need.
I just wanted to make the point that we wouldn't be able to use aspirin for everything that we do if we waited for FDA approval, and nobody's going to do any studies because they're so expensive.
Yes.
And so I think that while there are questions about using things off label, there's also lots of literature that can support off label use before the FDA gets around to it, or people have the grants to do the studies.
Mhm.
So it's not just things like what you're doing that are off-label.
So Bob, I do agree that it's a slippery slope with the off-label, but I'm a pediatrician and it's not uncommon to use drugs off-label because there aren't the studies and the therapeutics in pediatrics. And we try to extrapolate down, does this work in adults? Would it work in pediatrics? So here is my question. Would they ever use this on a burn patient, like a child?
That's a good question. I think it would have good uses that, common sense would tell us that that would be a very good place to use it, but it's interesting. I've not seen the burn units using it. But that's a good point.
Yeah, I'll just make a comment about the value of using your own biological material is that you won't trigger an immune response. So again, that's the big benefit.
The same sort of issue crossed my mind as why it isn't used in other applications. And my thought was that we had the wounded warriors coming home from Afghanistan and all these awful places. So I contacted a colleague who gave me another contact at Walter Reed. I said, is the military using this for wound healing she said no. So I didn't know where to follow that, but it would seem that would be the natural place to do the experiments because you've got horrific wounds. So it would, if it worked there, it would be, a tremendous advance.
I agree.
Any other questions?
It seems like these days, every drugstore and department store face cream has collagen slapped on the label. And lately, some TV doctors have been selling drinks and food supplements, and they're using the word collagen. It seems to me that if you're slapping it on your face or you're drinking it, it's not going to really get to where you need it to be. And I'm wondering, is the use of that word basically just advertising and bogus and has no effect on actual collagen?
Correct. I think for the most part, most products are not useful. The collagen powders are interesting, but I'm not sure how they get past the acid in the stomach and to the skin. One point that about collagen is interesting with the hair growth is that we do think that marine collagen is helpful for hair growth, which is a newer area of research, but I don't know if that's going to lead anywhere, but you're absolutely right. I'm not sure anything gets past the acid in our stomach.